we need to assess all points. First one is quality. Next is presence of P waves. P waves are present here. Here is present. This P wave is absent. There is short distance here, long distance here. It could be extrasystole. But main disease in this cut is another one. Deep. It looks like QS wave, yeah? RS wave. ST segment is elevated, T wave is here. But also there is M-like shape in V5, V6. Main disease is left branch bundle of His block. Because of block, in some leads we can see signs which look like a myocardial infarction. But to confirm is a myocardial infarction or not, we need to do lab testing. It's left branch bundle of His block plus extrasystole. It's not myocardial infarction. In this case, normal, something wrong, normal. Very big complex, normal, normal, very big again. Any very big complexes, if complex is one deformed, not everyone is deformed, but someone complex is deformed, it is ventricular extrasystole. Before extrasystole there is short interval of connection, P wave is absent. After extrasystole there is long distance. It is ventricular extrasystole. Quality P waves. Is it regular or not? We don't know. This distance is too big. There is bradycardia, if we will count heart rate. Electric axis of the heart is normal. The BDSR wave is here. Next, we need to assess segments, intervals, waves. PQ interval is 10 cells, 10 millimeters. Normally it have to be 5. So it is SA block. Oh, I'm sorry, SA. AV block first stage. It is AV block first stage. Slow conduction through the AV junction. This one will not be on the exam or on the control. There are sticks before complexes. These sticks are impulses of artificial pacemaker. Where is wrong place? P waves are here. If there is P wave, it is not F waves, it's just artifacts. Where is wrong place? Look from in the distance.
QR negative QRS.
Where is wrong place? Where is something wrong, which look different?
Negative Q.
These complexes and these complexes. Yes? From the distance we can see that these complexes are abnormal. Something wrong with them. This distance is short, next is long pause. So it is ventricular extrasystole. Complex is wide, deformed, more than 0.12 seconds. This case, where is wrong place? And to look at the card and try to find big root changes. This distance is long. Next, let's check why. It could be sinus arrhythmia, SA block, or extrasystole. P waves are present, but rhythm is irregular. This distance and next one are same, so it's not extrasystole. P waves are present everywhere. So there are two possible conclusions: sinus arrhythmia or SA block. If we will take this distance, we will be able to put it twice. SA block. This one. There is arrhythmia. So arrhythmical place is here. This distance is short, shorter than previous one or next one. This distance is long, longer than next one. P waves, present, absent, present, 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 absent, and pause again. So no P wave, and there is short interval of connection, long compensatory pause, supraventricular extrasystole. This complex is narrow, looks similar like a previous one. That's why it is supraventricular extrasystole. So compare these two cuts. Short, long distance, short, long distance, but this one is shorter than normal. This one is same as a normal. And P waves. P wave is present before pause. P wave is absent before pause. And this distance is twice longer than normal one. This card quality. P waves, regularity, and electric axis of the heart shifted to the left. This distance is too short. There is no either electric line between P and T. Yes? So it is tachycardia exactly. Tachycardia, width of complex is less than 0.12 seconds. So it is supraventricular tachycardia. P waves are present. So it is sinus tachycardia. There is short distance between complexes. So there is tachycardia. Rhythm is regular. P waves are absent. Complex is narrow. No P wave, narrow complex. It is supraventricular non-sinus tachycardia. This one. P waves are present. Distance is short. So there is tachycardia. But complexes are white and deformed. It's not ventricular tachycardia. I will explain why. Electric axis of the heart shifted to the left. Look at V1 and V5, V6. V1 R, deep S and elongated S. V5, V6 M-like shaped QRS complexes. So it is left branch bundle of his block, and together with block there is tachycardia. Because of block, complexes are deformed, not because of ventricular tachycardia. And P waves are present. In ventricular tachycardia, P waves are absent. So if P waves are present, you need to look more careful. This case, P R S T, P R S T T. So P waves are present. Rhythm is regular. Distance is too short. There is tachycardia. Complex is narrow. Narrow complex plus P wave. Which kind of tachycardia? Supraventricular sinus. Supraventricular sinus tachycardia. This one? Why irregular? Regular. Distances are same. They are F. They look like
sigmoid.
like sinusoid, yeah? P waves are absent, non-sinus. Non-sinus. Is there tachycardia or not?
Yes.
There is tachycardia. Tachycardia is non-sinus. Complex is wide, deformed. What is kind of tachycardia? Ventricular. What do we need to do? Defibrillation. So complex is wide deformed, no P wave. It is ventricular tachycardia. This one. Quality. P waves are absent. There is arrhythmia. No arrhythmia and absence of P wave. What is it? No. Case number 2 on the blackboard. Atrial fibrillation. No P wave and irregular rhythm. F waves are invisible. Very short distances, yeah? So there is tachycardia. Complex is narrow. Tachycardia is supraventricular. Is it P or T? P, T. Is it P or not?
P, I think.
It's not clear, yeah, in this lead. So let's check another lead. It's clear that it is T wave. It is T wave. That's why this is T wave 2. So P wave is absent. Non-sinus supraventricular tachycardia. This one is not very good. It looks like an extrasystole. Very short distance, but there is pause after this. No P waves, but not very good card because of the no next complexes. Very short distance. Tachycardia. Let's check this lead. It is T. So P wave is absent. Non-sinus supraventricular. P wave is present. Quality. P wave is absent. In another leads, it's absent. Non-sinus. Is it regular or not? It's not clear in this lead. But here it is regular. In this place, distance is short. So in this place there is non-sinus supraventricular tachycardia. If rhythm is non-sinus, extrasystole will not be detected. It will be, it will look like atrial fibrillation. All extrasystoles can have special subtypes. If every second contraction is extrasystole, it is bigymenia. This case is bigymenia of ventricular extrasystole. 2 normal, 1 abnormal, 2 normal, 1 abnormal. It is trigymenia. This one, 3 normal, 4th is abnormal. Quadrigymenia or tetragymenia. If we saw normal cut before, next we start to see that something happened, tachycardia happened, or atrial fibrillation happened. It is paroxysm. In this case, paroxysm of ventricular tachycardia. Next, normal contraction and paroxysm of tachycardia again. This one, normal, abnormal, normal, abnormal, normal, abnormal. So every second is extrasystole. It is bigymenia. But also, this complex and this and this and this are different. So it is polytopic extrasystole. There are many different areas which start generate extrasystoles in the ventricles. That's why all complexes are different. What is it? Which one? Ventricular. Why deformed complex? And this one? Doesn't matter in which side to turn it. Everything is irregular. No clear complexes. It's not atrial, it's ventricular fibrillation. Ventricular tachycardia, next ventricular fibrillation, next asystole, and patient is dead. This case, rhythm is irregular. P waves are in the second lead. They are absent. No P waves. There are F waves, small F waves. It is atrial fibrillation. This card will be on the exam. This card contains all types of the blocks. First block is SA block. PQRS, PQRS, long pause, next P wave, no PQRS complex. SA block. M like shape of P wave, intra-atrial block. Prolonged PQ distance, constantly. It is AV block, first stage. AV block Mobitz 1. Distance close to normal, longer, P is present, QRS complex is absent. AV block, second stage, Mobitz 2. PQ distance is constant. P is present, QRS disappeared. Full AV block or AV block, third stage. P waves has own rhythm. QRS complexes has own rhythm. Tachycardia, P waves are present, complexes are narrow. Sinus tachycardia. There is arrhythmia in this place. P wave, no P wave, P wave, P wave, P wave. So there is no P wave. Complex is narrow. Long pause after short distance before. It is extrasystole. Which one? Supraventricular. Complex is zero and looks similar like the previous one. This case, everything was okay. Next patient made inhale and stopped breathing. P waves are present and there is arrhythmia. This distance is shorter than normal one, but P waves are present. And this condition is in constant. So, what is it? P waves are present everywhere. Rhythm is sinus or not? Sinus. There is arrhythmia. Normal distance, this one. Can we put it twice to this place?
Yes.
This one? No. This one, yes, we can, but this one is short. It's not normal. It is sinus arrhythmia. Patient made inhale and inhale provoked arrhythmia. It is sinus arrhythmia. In SA block, we would able to put this normal distance twice. This one is SA block. P waves are present everywhere. There is arrhythmia. This distance we can put twice to this place. That's why it is SA block. And this condition is constant in this case. Quality is abnormal. We need to change equipment. This one. P waves are absent, there are big F waves. It is atrial flatter. And there is arrhythmia. Rhythm is irregular, so it is incorrect type of atrial flatter. M-like shape in V1, V2. And this lead may be a little bit elongated QRS complex, but not exactly. Main criterion is this. What is it? Right branch bundle, his block. This one is the same as before. It is SA block. P waves are present. This distance we can put twice to both place. Where is wrong place? And this. So these places are with extrasystole. Ventricular one because of complex wide and deformed. Tachycardia. Complex is narrow. P P wave is absent. This one is T wave, it's not P. So it is non-sinus supraventricular tachycardia. This case, P waves are absent, rhythm is irregular. Non-sinus arrhythmia is, what is name of non-sinus arrhythmia? Atrial fibrillation. If you will conclude in this cut flutter, because of there are some big waves in this place, it will not mistake. Atrial fibrillation and flutter are practically same conditions, but everything depends on size of muscles which contract asynchronously. Wait, wrong place. This and this. What is it? Bundle of His block is constant. All complexes will be deformed. In this case, M shape is present, yes, but only in one complex. One and this one. And other complexes are normal. So what is it?
Right.
In right bundle of His block, all complexes are M-like in one lead. In this case, two complexes are M-like and other complexes are normal. In left branch, all complexes will be deformed in V1 with V5 V6. In this case, all leads are affected. What is it? Is rhythm regular? No. Is the P wave here? No. And this complex is deformed. After this complex there is pause. Extrasystole. Ventricular extrasystole. If you see one wrong place in lead, only 1-2 wrong places, it's extrasystole. If complex is deformed in one place.
Okay, isn't this P wave?
It's normal complex. This complex is abnormal. Because abnormal complex, no P wave. Tachycardia. Complex is narrow. So it is supraventricular tachycardia. What is this wave? Let's confirm. T, no P. So it is non-sinus. And last one. M-like shape in V1, V2. Right branch bundle of His block. That's it.